Hi, I'm Mahima and I work on the Simple team. Simple is a fast, free app for clinicians to manage their patients with high blood pressure. Today, it is being used in over 500 healthcare facilities. We are very excited to introduce Simple to you. This training has 10 chapters. We will teach you how to use this app correctly to manage your patients with high blood pressure. At the end of this training, you can start using this app at your hospital. Now, please take out your Android phone or tablet and follow the steps with your phone or tablet with me. Let's start with Chapter 1. You will learn how to install the app and create your own account. Open the Play Store app on your Android phone. Search for Simple app. Select the app with the red drop-down icon and press the install button. If you need more time to install the app, then please pause this video. Once everyone has installed the app, then let's move forward to the next step together. Great! You've installed the app. Please open it. You will now create your account. Again, please follow the steps with me. Open the app. You're a few steps away from creating your account. Press Next. You can use Simple to search and find thousands of patients with hypertension, maintain records of blood pressures and medicines, remind patients to return for visits. Now, press Get Started. Next, select your country. Then, enter your phone number. Enter your full name. Enter a PIN. It is any 4-digit number that you can remember. It's like your password. Press the button that says Allow Location Access. Then, press the Allow button when you see it. This will help you find your clinic faster. Great! Now you would need to select your facility. Search for the name of your clinic and when you find it, select it. Make sure to select the clinic where you work. This is very important. Confirm the name of your clinic. Here is a short video on how to use Simple. Please pause the training and watch this video. If your clinic is not in the list, please inform your trainer right now. Please ask them which facility you should select for this training. The last thing you need to do is to get approved. Please ask your trainer to approve you. After your trainer approves you, please close the app and open it again. You're ready to start using the app. Great! You've installed the app successfully. Hope you found it easy. In the next chapter, we will share an introduction of Simple with you. Hi! In the last chapter, you installed the app on your phone and created your account. Now, I'd like to give you an introduction to Simple. Simple is an app for clinicians like you to manage their patients with high blood pressures. It is used by nurses, doctors, health counselors, community healthcare workers, and pharmacists in over 500 healthcare facilities. It has two parts: an app that you just installed and a BP passport or a BP passport sticker. Please make sure that you either have a BP passport sticker like this or a card with you right now. Every time a patient with hypertension visits your facility, you can record their data quickly, in less than 20 seconds. With a record of your patient's BP history and medicines, you can make sure that they are treated according to protocol at every visit. When a patient misses a scheduled visit, Simple sends them a reminder text and provides you with a list of missed patients who you can call. Also, you can track your facility's progress over time. This feels good because you can see all the hard work that you have put in. Let's get an overview of the app. Please open the app on your phone. You will see 3 sections on the top. Patients. You can register new patients and follow up patients from here. Overdue. You can make calls to patients that missed their visits. Progress. You can track your facility's progress in managing patients with hypertension. Now let's look at the stop bar. Here, you see your selected facility. If you temporarily work at a different facility, you can change it from here. This button is for help. You will find resources that guide you on using the app. This button is for settings. In the settings page, you can change the language of the app. Please set it to a language that you are comfortable in. Your trainer will tell you in which language you need to enter patient data. All hospitals in one region enter patient data in the same language. Our team has designed the app to be very convenient and easy to use. I'd like to share some of its features with you. You can find a patient and record their data in less than 20 seconds so that you can focus on patient care. The app sends very little data, about 20 MB per month. The app also takes only about 20 MB storage. That is the same amount as 5 to 6 photographs. The app will work without a good internet connection. Data will sync when you get an internet connection. The app uses industry standard security measures to ensure that your patient's data is safe. Simple does not access any of the personal information that you have on your phone. And that's all. In the next chapter, we will register our first patient. Hi, in this chapter, we will learn how to register a new patient in Simple. Here is a question for you. Who should you register in Simple? All patients who are diagnosed with hypertension or who are taking hypertensive medications should be registered in Simple. Close your eyes. Imagine you're working in your hospital. You're taking BPs and managing patients just like a normal day. A patient comes to you who's diagnosed as hypertensive. Let's register them into Simple. Before you register a patient, make sure you have the correct facility selected. Your patients will be registered here. The first step of registration is to take an empty BP passport and write the patient's name on it. For this training, please write your own name on it. You will be registering yourself as a patient. If you are using a BP passport sticker, paste a sticker on the patient's health book. For this training, you can paste it on your own notebook. Open the app and press the Scan BP Passport button. Press on Allow for Allow Simple to take pictures and record video. Now, please scan this QR code on the BP Passport. When it's scanned, enter the patient's name. Press Next. Check that the patient is already not present in this search results list. Press the Register Patient button. Enter the patient's full name. Next, enter age or date of birth. Please enter the date of birth if the patient knows it. Next, select gender. Add the patient's phone number. It will help you call the patient for follow-up and to find them later in Simple. Add their village or colony. And check for district and state. Press Next. First, enter the patient's diagnosis. This is mandatory. Next, please ask the patient for their history of heart attack, stroke, and kidney disease. If you don't know the answer, leave the field blank. When finished, press Next. We'll now enter the BP and medicines for the patient. Tap on the blue blood pressure button. Enter the systolic and diastolic values. Here is an exercise for you. Please enter a BP of 173/114 for your patient. Next, let's enter the medicines prescribed to the patient into the app. Tap on the blue medicines button. Select the medicines and dosages. Here, I'm selecting amlodipine 5 mg for this patient. Please enter amlodipine 10 mg for your patient. If you'd like to add a medicine that is not in the list, you can add a custom medicine. Press Edit Medicines. Next, press Add another medicine. Type the name and dosage of your medicine. Press Save. Please enter nifedipine 10 mg for your patient. Sometimes, you may not be able to enter a patient's data immediately while seeing a patient. You can enter their BP for a previous date. Tap on the date and change it to a previous date. Enter a BP for yesterday for your patient. You should now have 2 BPs for your patient, 1 BP for today and 1 BP for yesterday. We have entered the patient's BP and medicines. Now, we will save the patient record and schedule their next visit. To save the patient's record, press Save. The default, as you see here, is 30 days. You can decrease or increase the number of days after which the patient needs to return. Or, you can select the exact date using this calendar. Schedule your patient's next visit on the next Monday. If the patient needs to go to a different facility at their next visit, please select it from here. And when you're done, press Done. That's all. Your patient was registered. You can see them in the recent patients list. If you don't have a BP passport at your facility, you can still register a patient easily. Enter the patient's name. Check that the patient is not in the search results. Tap on Register as a new patient. Register the patient's name and enter their BP. Save and schedule their follow visit. Now, I'd like you to register another test patient. This time, please enter a friend's name. Good work! We learned how to register a patient, to enter their BP and medicines, and to schedule their next visit. We learned that you can do this with a BP passport as well as without a BP passport. You will have 2 patients registered in your application, one with your name and one with your friend's name. If you have any questions, please pause the video and ask your trainer. Thank you. Close your eyes and imagine that you're at your facility, seeing patients. Your patients are visiting you for follow-up care. When your patient returns for a follow-up visit, please add their BP and medicines into Simple. Ask the patient for a BP passport. A BP passport is a patient ID with a unique QR code in it. Let me show you how to find a patient in Simple. Press the Scan BP Passport button. Scan the QR code on the passport and you should quickly find your patient. It takes just a second to find the patient's details. Then, add the patient's BP and medicines. Remember the patient that you registered in the previous chapter? Please scan the BP passport of that patient. When you find the patient, add a BP for them. Were you able to find your patient? If you were not able to find your patient by scanning, please pause the training. This is an important feature to learn. Continue when everyone understands how to find a patient in the app by scanning. You can also search for your patient using the BP passport number that you see here. If at any time you find an issue with scanning the BP passport, you can use this number. Press the Scan BP Passport button. Type the BP passport number. Next, press Search. We know that sometimes patients will forget to bring their BP passport with them. Don't worry, you can still find them in the app. Search your patient by their name or phone number. Tap on Enter Patient's name. Enter the patient's phone number. Look carefully and find the right patient from the search result. You can also find your patient using the list of all patients. Tap on Enter Patient's name. Here, this is a list of all the patients at your facility. Like before, here are a few exercises. Please complete each one of them. Search for the patient that you registered in the last chapter by their BP passport number. Your patient forgot to bring their BP passport. Search for the patient by their phone number. Search for the same patient by their name. So we learnt about how to search for follow-up patients. This is an important function and you will use it very often. Make sure you understand it well. If you have any questions or were not able to find your patient in the app, pause this video and get your doubts clarified. In the next chapter, we'll learn about paying attention to finding the right patients in the app. Hi, in this chapter we'll learn about finding the right patient and why it is important. If your patients do not have their BP passport or they forget to bring it, you can search for them by their name or phone number. In these cases, it is important to look at the search results carefully. This is because there can be many patients with the same name. When you're looking at the search results, make sure that the name, age, address, phone number, and last visit date match. This will help you identify the right patient. Here, I want to find a patient named Asha Begum. When I enter the patient's name, I see that there are many patients with the same name, Asha Begum. I carefully look through the search results. I match her age, phone number, address, and date of last BP. I can also click on a specific patient to match more details. When I'm sure that this is the right patient, only then I update their BP and medicines. Your phone contains records of all patients in your facility's district. If a patient is registered at a different facility within your district, you can still find them in Simple. My facility, as you see here, is CHC Vadwani. I am searching for a patient with the name Dhruv Saxena. He is not registered in my facility, but in a facility nearby. On the top of the search results here, I see patients who have visited my facility. When I scroll down further, under More Results, I can see patients from a different facility in my district. Here, this is the patient I was looking for. In this chapter, we learned that it is important to take the time to find the right patient and only then update your patient record. Thank you. Patients will sometimes miss their appointments. In the overdue section, you will find a list of all the patients who have missed their visit. This gives you the ability to call them and remind them for follow-up. Patients with the highest risk are at the top of the list. Secondly, patients in the list are ordered by how recent their missed visit was. We recommend that you call the patients from the top of this list. There are 2 steps to calling overdue patients. By pressing the call button, I can make a call. In some countries, you will see 2 options for calling: normal call and secure call. Secure calls hide your number and are toll-free. Normal calls are regular phone calls. Using either option, you can contact the patient. When you contact the patient, remind them of their missed visit and ask them to visit your facility for their checkup. You will see 3 options: mark patient as agreed to visit, remind to call later, remove from overdue list. Let's learn what each of these options mean. If the patient said they would return for follow-up soon, mark them as agreed to visit. If no one answered your call, or if you were unable to talk to the patient, choose Remind to call later. Set a time after which you would like to be reminded. If the patient needs to be removed from the overdue list, select the reason for it and remove them. The reasons can be: you tried calling them at least 3 times a day and they are not responding, patient's phone number does not work, they were transferred to another public facility, they moved to a private doctor, patient died, or any other reason. Tapping Done removes the patient from the overdue list. When patients miss an appointment, Simple sends them a text message reminding them to visit the facility for a checkup. This message is written in the local language of your area so your patients will understand it. This is all about the overdue section. Like before, if you have any doubts, please pause the video and get them clarified. Hi, we've made a lot of progress in the previous chapters. We learned about how to register a patient, how to record a follow-up patient, and how to call patients who miss their visit. Now, let me show you a few more important features of the app. Just like you create daily and monthly reports at your facility, Simple gives you useful reports to track your patient's progress. Here you see the number of registered patients and follow-up patients for today and for every day in the last month. Total registered patients at your facility, all time and for the last 6 months. Similarly, total follow-up patients, all time and per month. How good is hypertension control at your facility? And this is a fun feature. Every time your facility reaches a new milestone in seeing follow-up patients, you will unlock a new badge. Open the progress section in your app. Take a look at the different data that's available. Which data do you find the most useful? Is there anything that you do not understand? If you're also asked to record blood sugars into Simple, you can add blood sugar measures and medicines for your patients. If you would like to add blood sugars but do not see an option, please speak to your supervisor. Press here to add a diabetes measure. Select the type of diabetes measure. Type the value and press enter. Just like for hypertension, you can add medicines for diabetes too. Simple will work even if there is no internet. Every few minutes, the app checks if you have internet and saves your records to a central server. This is called sync. This sync button tells you about when your patient records were last saved. When you want to start syncing your records, press the sync button. When the button is green, it means that all your records were synced successfully. Go to the main screen of your app. Please check what is the color of the sync button right now. Press the sync button to start a sync of your records. This list of recent patients helps you quickly access the patients who recently visited at your facility. Press on See All to see a log of all the recent patients at your facility. This edit button on a patient screen allows you to change a patient's details like name, phone number, date of birth, address. Sometimes patients don't have their phone number on their first visit. You can ask them to bring their number the next time and update it here. That's the end of this chapter. Our team is always looking for feedback on how we can make the app even simpler and easier for you. Please let us know how we can improve Simple for you. Hi again. Before we begin, please take a notebook and write down all the questions that you might have about using this app. What do you see as difficulties in using Simple at your hospital? Here are some of the common questions that healthcare workers have asked us before. How can I assign a new BP passport to an existing patient? This is a common question and an important one. When a patient loses their BP passport, you can easily assign a new one to them. Scan a new BP passport. Type the patient's full name and search for them. Select the right patient. Assign the BP passport to them. Here is one last exercise for this training. Remember the patient that you had registered earlier in your own name. Let's say they've lost their BP passport. You need to assign a new BP passport to them. This exercise has two parts. First, assign a second BP passport to your registered patient. Then, scan this new BP passport and confirm that you can find the patient. What should I do if I forget my PIN? Tap on Forgot PIN and enter a new PIN. Please ask your supervisor to approve you again after you create a new PIN. What should I do if I change my phone? It's easy. Download the simple app on the new phone. Sign up with your phone number. Then, select your facility in the app. You will get a verification code on your registered phone number. On entering the verification code, all your patient records will be synced to your phone, like before. What if there is no internet connection at my facility? This app works even when there is no internet. Your patient records will get automatically synced when your phone is connected to internet. You also have the option to manually save your records by pressing the sync button. Can 2 or more people use Simple at the same healthcare facility? Yes, many nurses and doctors can use the Simple app at the same facility. Make sure that your app is synced regularly. You can confirm this by checking that the sync button in the app is green. This will ensure that all Simple users at your facility will see the latest data. You may have more questions about how to use Simple. Do ask your trainer. In the next chapter, we'll talk about how to get help in Simple. Congratulations! We've finished going through all the topics for using Simple. If this is the first time that you're using an app for work, we'd like to acknowledge that it can be difficult or confusing. Whenever you have any problems using the app, you can ask for help. Here on the help screen, you will find resources for all the important topics of using Simple. When you want to learn about a topic or have a question, come to this help screen. Secondly, you may see this button to send a WhatsApp message to the Simple team. Please use it. Our team will always answer your questions. And thirdly, please ask your supervisor if you face any problems while using the app. They will be able to help you out. We really appreciate the hard work that you put in saving lives from heart attacks and strokes. Your efforts make it possible for care to be within reach for every patient. Hi! Soon you will start using Simple to manage patients at your facility. Before that, let's delete the dummy patients that you created during the training. For each patient that you created today, open their details. Press Edit. Press the button Delete Patient. Select the reason Patient registered by mistake and delete the patient. In this way, delete all the patients that you created during training. Make sure that you understand all the topics in this training well and then use Simple at your facility. If you did not understand something here, go to Help in the app and you can watch this training video again. When you start using Simple at your facility, register every patient who is diagnosed with hypertension or is taking hypertension medications. Registering every patient and monitoring each one of them will be key to improving hypertension control rates at your facility. In closing, here are the 4 things you need to remember. Select the correct facility. This is where you will find your registered patients. Find your patients carefully. Sync the app regularly and update the app to the latest version. Again, we appreciate all the hard work that you do providing care and treatment to patients and saving lives from heart attacks and strokes. We hope that you find Simple very useful in your work. Thank you.